Have you or your elderly parents ever had a bout of constipation? Do you know when you can self-treat or when it's time to see the doctor? Do you know how to safely treat it? By the end of this video, you will know when it's time to get to the doctor and when it's fine to go ahead and self-treat. By subscribing to my channel and hitting that little bell, you'll be notified every Monday when I post a new video that's designed to help you navigate this sometimes confusing healthcare system. Good morning, health-minded people. I'm Dr. Snow, and over the years I've helped many patients when they have that embarrassing condition called constipation. Constipation can hit any of us at any time, and while usually it's very safe to self-treat, it can be embarrassing to ask for recommendations. However, let me assure you that most pharmacists have seen it all, and we are not embarrassed by your questions. Today I'll explain what constipation is, what causes it, how to treat it, and how to know when it's time to go to the doctor. Everyone has a different regular and a different schedule when it comes to bowel movements. The definition of constipation is infrequent stools or hard to pass stools. The symptoms of constipation include abdominal pain, bloating, and the feeling that you're not quite empty. While constipation can start out as annoying and slightly uncomfortable, if left untreated, it can lead to some serious complications. These complications include hemorrhoids, anal fissures, rectal prolapse, and fecal impaction. Fecal impaction, if left untreated, can actually lead to death. Did you know that constipation could be so serious? Comment below. I had no idea. Constipation can be caused by a number of things. Not drinking enough water, not eating enough fiber, not getting enough exercise, ignoring the urge to defecate, and stress and depression can cause constipation. Certain medications, such as opioid pain medications, can also cause constipation. Some blood pressure medications, antacids if they're used too frequently, antidepressants, anticonvulsants, and iron supplements are notorious for causing constipation. And antihistamines and medications for urinary incontinence are designed to dry you up, so they also dry up your stool. If you've started a new medication recently and suddenly have constipation when you've never had constipation before, you need to check with your pharmacist to see if it could be the new medication causing the problem. If it is the new medication causing the problem, your pharmacist can work with your physician to either change the medication or maybe get you on a regimen to prevent the problem. Also, constipation can be a problem with pregnancy. In certain medical conditions, such as multiple sclerosis, Parkinson's disease, lupus, diabetes, hypothyroidism, and patients that have had a stroke can also develop chronic constipation. So how do you prevent constipation from happening? First of all, get plenty of fluids. You should drink at least 64 ounces or 8 cups of water or other fluid every day. And all fluids count. It used to be thought that the caffeine in tea and coffee caused a diuretic effect or made you get rid of water, but that theory has been disproven and all fluids count. It's still probably best to avoid sodas because they are so high in sugar, and the artificial sweetened sodas are just evil, so stay away from soda. You should eat plenty of fiber. Fiber is found in fruits and vegetables. The goal for men is about 38 grams per day, and women should aim for about 25 grams a day. However, most Americans only get approximately 15 grams of fiber every day, and you do not want to jump straight to the goal immediately. This will cause abdominal cramping and gas. So you should start slowly if you're not used to eating a lot of fiber in your diet. You can start with eating a piece of fruit or a helping of raw vegetables once a day for about a week. On the second week, add a second helping. Bear in mind that many fruits contain a lot of sugar, and especially if you're diabetic, this may be concerning. However, berries are a great choice of fruit that have lots of fiber but little sugar. Berries include strawberries, raspberries, blackberries, and blueberries. Dry beans have a lot of fiber, but if you're not used to eating them, they can cause a lot of gassiness and abdominal cramping. So if you decide to add dry beans to your diet, start slowly. Another good way of adding extra fiber to your diet is to sprinkle dry nuts or seeds to your salad. Fruits and vegetables that are mostly water, such as watermelon, cucumbers, citrus fruits, and tomatoes, count both towards your fiber intake and your water intake for the day. So, win-win. Also, getting plenty of exercise helps keep things moving along. Walking for 30 minutes a day, either in one session or split up in 2 or 3 sections, is great exercise for everyone and helps reduce your risk of constipation. Yoga, swimming, and dancing can also be helpful. You should always wait 30 minutes after a large meal before you get any kind of exercise to give your body time to digest the food you've just eaten. And if you feel the urge to go, go. If the stool sits in the colon and you deny the urge to go, then your body has more time to reabsorb the water and you have a harder, drier stool. So what do you do if you do become constipated anyway? There are many products over the counter that are designed to help relieve constipation. The recommendation is that you start with an osmotic laxative or a stool softener, which draw water into the colon and into the stool to soften it. Miralax, or polyethylene glycol 3350, is safe for all ages, from infant to very elderly adult. Other over-the-counter osmotic laxatives include magnesium citrate and milk of magnesia. If you use an opioid pain medication routinely, your physician may recommend that you also take a stool softener such as Colace to prevent constipation. Opioids slow down the motility of the GI tract, giving the body more time to reabsorb the water from the colon, creating dry stools. If a stool softener isn't enough, bulk laxatives are the next step in preventing or treating constipation. Bulk laxatives are made from insoluble fiber that are not absorbed by the intestine, and they stay in the colon, creating a bulkier, more water-holding stool. Bulk laxatives include Metamucil, Fibercon, and Citracel. The final class of over-the-counter laxatives, and the ones that should be used as a last resort, are the stimulant laxatives. These laxatives act upon the colon muscles to contract and push the stool out of the body. Stimulant laxatives should be used only rarely and only in extreme circumstances unless otherwise directed by your physician. These laxatives can cause abdominal cramping and diarrhea. Stimulant laxatives include Dulcolax, Correctol, and Senecot. The biggest problem with stimulant laxatives is if they are used too often, your body may forget how to push the stool out on its own and become dependent on the stimulant to do so. This dependence may be impossible to overcome. So when is it time to see the doctor rather than self-treat? If you find blood in your stool, call the doctor. If you have been treating yourself for more than just a couple of days with no relief, it's time to go. If you've been treating yourself for more than 3 weeks with nothing more than small stools, it's time to go to the doctor. If you have never had constipation before and you have stomach pain, get to the doctor. If you are losing weight and you're not trying to, go to the doctor. I have written an ebook that helps parents and children address subjects that may be difficult to bring up but are necessary to plan for the future. You will find the link to get this free resource in the description below. I am sure it will help start the conversations that are so important. If this video has helped you understand how to prevent constipation and how to treat it once it does occur, please give it a thumbs up and consider subscribing to my channel. Do you have questions about how to care for your aging parents that you would like me to answer? Leave your suggestions below for videos that you would like to see me make. Thank you for joining me today. Stay healthy and have a blessed week.